Inflation is at its lowest level since 2021. That's according to the Bureau of Labor Statistics. But those on a fixed income are still finding it hard to make ends meet. From utilities and healthcare to food and nutrition, there is help available if you know where to look. Well, hello, I'm Tony St. James. Welcome to this month's edition of Rural America Live with AARP. You know, older adults, without ever realizing it, are leaving billions of dollars in financial aid on the table each year. You know, that money can help pay for utilities, rent, prescription drugs, groceries, and more. And tonight, our friends from AARP will share information about those programs, and we have AARP's Medicare expert joining us a little later and answering your questions. So we want you to join the conversation by giving us a call, 877-283-7570. That's 877-283-7570. Okay, here's our question of the month. We want to know, what bills are you struggling with? And we're giving away a cooler to 5 lucky on-air callers. So pick up the phone, join our conversation. We're wasting no time in taking your calls. Phone lines are open right now, so give us a call, 877-283-7570. Now, you don't need to be a member of AARP. You don't have to be 50 years of age or older to win. But as a reminder, you can win only once each calendar year. If you're a past winner and you've not yet received your tote, be sure to return the AARP Volunteers Call, provide an address, and just so you know, AARP pays all the shipping cost. Now, if you're not a lucky winner tonight, you can still enter AARP's Second Chance Sweepstakes. Go online, aarp.org/AARP Live, or scan the QR code on your screen to enter. One cooler will be given away each month, and I'll announce the winner later in tonight's show. Rules apply, and you can only win one time in a calendar year. All right, I want to welcome our friends from AARP. We've got Brad Anderson, AARP Vice President for Community Engagement, and Greg Marshaldon, State Director for AARP Vermont. It's good to see you both in here, and we've got some important information to share and some programs that, honestly, I didn't even know about, so I'm looking forward to learning a little more. But before that, Greg, let's talk about the recent Social Security announcement.
Yeah. Well, last Thursday, the Social Security Administration did announce its annual COLA increase, or the cost of living increase for Social Security beneficiaries. And that was a 2.5% change this year. So a 2.5% increase for all Social Security beneficiaries. So in January, the average monthly Social Security benefit is going to go up about $49 on average per month for all Social Security beneficiaries. But unfortunately, Medicare premiums for Part B will also increase just over $10, so that'll take a little bit out of that $49. And next year, that will make it about $185 for that Part B premium. And all veterans are going to see the same COLA increase at 2.5% as well. So, you know, there were years where the COLA increase was flat, you know, none at all. So we're seeing a little bit of an increase this year, but still, for folks living on Social Security, not much more. It's not a huge increase.
Okay, let's talk about some of the benefits that are really going unused or underused. Brad, what can you tell us?
Well, Tony, I can tell you right now, Americans are leaving too much money on the table when it comes to some of these benefits. There's some great benefits out there, and I want to talk about 4 of them in particular. So let's get right to it. Let me start with energy. The first one I want to talk about is LIHEAP. And so LIHEAP stands for Low Income Home Energy Assistance Program. And this is one that helps with your heating costs throughout the winter. We all know winter is coming, right? And so it's very easy to apply for a one-time payment to defray heating costs. And, you know, the payments that you get, the one-time payment does vary from state to state. So in Iowa, it's around $470, that payment. Here in Tennessee, I looked it up, and it's around $600. So it does vary from state to state. Next up, let's go to Medicare savings. There's something called the Medicare Savings Program, and this helps eligible older adults pay for their Medicare Part A and Part B deductibles, co-insurance, and co-payments. And so this is a big program because older adults can save more than $2,000 per year through this program. Yet, believe it or not, more than 3 million eligible older adults, 65 and older, are not enrolled. And so we're leaving billions on the table because they're not enrolled, and even though they're eligible. So again, you can save $2,000 per year by enrolling in the Medicare Savings Program. Next up is something we've probably all heard of, and that's called SNAP, the Supplemental Nutrition Assistance Program. This is funded through the Farm Bill. And it helps those who need it, often older Americans who are on a fixed income, rely heavily on SNAP. And so this can help, SNAP helps with your grocery store costs, and also if you go to a farmer's market now, that's a recent development. And studies show, despite the fact that people need help paying for their groceries now more than ever, in this age of inflation, 63% of eligible older adults do not take advantage of these SNAP benefits. So they're eligible, but they're not taking advantage. They're leaving money on the table. Finally, I want to talk about something to help pay for prescription drugs, and that is a program called Extra Help. That is the name of the program. It's Extra Help. This program can cover monthly premiums, annual deductibles, and co-payments for their Medicare drug coverage. And so what does this amount to? This is another big one, Tony. Studies show Extra Help is worth around $5,100 per year for eligible participants. And we're going to have an expert, Lee Purvis, who's an expert through AARP about prescription drugs, talk a little bit more about that program and some other programs. But I'm just here to tell you there are so many great programs out there, and you can get more by Googling the names of them. And of course, go to AARP Live, and on that website, we've got some additional information about these great programs.
It's amazing how much money could be left just sitting on the table. So, okay, we're going to take a quick break, but before we do, we've got some great information about financial assistance. The phone number to call is 877-283-7570. That's 877-283-7570. And again, we're so glad you're joining us. We have coolers to give away tonight, so give us a call, 877-283-7570. We'll be right back.
I can't afford Medicare. Is there any financial help available?
Yes. Medicare beneficiaries who are also on Medicaid get some or all of their out-of-pocket costs covered. Medicaid is a joint federal and state program that helps some people with limited incomes get their medical care. More than 12.3 million people are what the federal government calls dual eligible.
How do I qualify to become dual eligible?
Each state has its own Medicaid program. It needs to follow federal guidelines, but each state gets to set eligibility standards and what it covers. You'll need to contact the program in your state to see if you meet its qualifications, including its income threshold.
What if I don't qualify for Medicaid but still need financial help?
Medicare has 4 savings programs: Qualified Medicare Beneficiary, Specified Low-Income Medicare Beneficiary, Qualifying Individual, or Qualified Disabled and Working Individuals. These programs can help pay for Part A and Part B premiums and other out-of-pocket costs like deductibles, co-pays, and other charges. Which program you qualify for will depend on your income. Check with your state's Medicaid office to see if you qualify for any of these programs.
What about prescription drugs?
The Extra Help program assists people with limited resources in paying for Part D prescription drug plan premiums, deductibles, and co-pays.
How do I get extra help?
If you qualify for the Qualified Medicare Beneficiary or the Specified Low-Income Medicare Beneficiary program, you automatically can enroll in Extra Help. You can apply through the Social Security Administration. To learn more, go to aarp.org/Medicare.
Welcome back to Rural America Live with AARP. Medicare Parts A and B, veterans benefits, prescription drug coverage, supplemental coverage. You know, navigating benefits can be complex and confusing. We have our friends from AARP here, and they've brought a very special guest to answer your benefit questions tonight. We have 5 coolers to give away, and you could be a winner. So pick up the phone. Lines are open right now. Give us a call, 877-283-7570, and join the conversation. And if you're not a lucky winner tonight, you can enter AARP's Second Chance Sweepstakes, aarp.org/AARP Live, or just scan the QR code on your screen to enter. 1 cooler given away each month, with the winner announced during next month's program. And we'll announce last month's Second Chance Carry-Alto winner a little later in the show. Right now, I'm here with Brad Anderson, AARP Vice President for Community Engagement, and Greg Marshaldon, State Director for AARP Vermont. And they brought along a very special guest, Lee Purvis. Lee is AARP Medicare expert. Welcome to the show.
Thank you for having me.
Okay, first, tell us a little bit about your role at AARP.
Sure. So I sit within what is known as our Public Policy Institute. And with my job, that basically means that I'm responsible for AARP's policies around prescription drugs. So that can be anything from prescription drug pricing to how the Food and Drug Administration regulates drugs to prescription drug coverage, which is what has brought me here today.
Okay. There are new changes coming to Medicare. What are those?
Wow, that is a really big question, and I'm very glad that you asked it. So in 2022, a new law was passed that included a lot of provisions that are actually going to make the Medicare program more generous, specifically around prescription drugs. And so what we are starting to see is that law rolling out. So starting in 2025, there will be a new $2,000 cap on annual out-of-pocket costs. So no one in a Part D plan will have to spend more than $2,000 on their prescription drugs. Some other really important changes are a new $35 copay cap for insulin. So no one will be paying more than $35 when they fill their insulin prescription. You can also get recommended vaccines for free if you're in a Medicare prescription drug plan. And another really important change that's coming next year is that now you're going to be able to spread your out-of-pocket costs over the year. So rather than potentially having to pay some very high out-of-pocket costs at the beginning of the year, you could actually spread that out, which will help people who are on a budget.
Okay. I guess another one is a cap on prescription drugs. What's happening there?
Yeah, that is a huge new benefit. I cannot talk about that enough. Previously, under the Medicare Part D program, there was no limit on how much you had to spend on your prescription drugs. And so people taking expensive drugs were sometimes spending upwards of $10,000 a year just on those drugs. So the fact that there's now a hard cap on how much people have to spend every year is an incredibly important improvement for people who are facing some very high costs.
Okay, so we've got callers waiting, but what would you like to hear from callers tonight?
You know, I do love talking about prescription drugs. So to the extent that anyone has any questions about their prescription drug coverage, I would love to hear from you. I'm really interested to hear in, potentially how I could help, and then also just what you're hearing out there and whether you're hearing about this new law that, again, is just so important.
Okay, so the phone number again is 877-283-7570. That's 877-283-7570. Greg, what about finding benefits in your area? I mean, how do we go about that?
Well, this is really a significant issue because many people don't know that there's a lot of benefits available to them, and then they sit there and they don't know where to go. But a great place to find benefits in your area is benefitscheckup.org, and it's a really simple platform to use. You put in your zip code, and you search for things like food, nutrition, disability services, and many other things as well. So if you put your zip code in, it'll show you what's available to you in your area. And what we do know, what Brad said earlier, is hundreds of millions of dollars are left on the table each year for people that really need this type of assistance, but they just don't know where to go. So benefitscheckup.org is a really good place to start. And again, it covers the waterfront from issues around food and nutrition assistance, fuel heating assistance. We're coming up on the winter months, prescription drug assistance, a range of stuff. And it shouldn't be this hard to find. but it is, and a site like this can help navigate for you.
You know, I also wonder about signing up the first time. Whoever wants to take this one, that can be a challenge, can it?
Yeah, it can be. And some of this is just getting yourself sort of over that hump. And again, part of navigate, it's sort of it's sort of like a big, Rube Goldberg chart. They just don't know where to go. They think something might be available to them, but they don't know where to start, where to begin. And if you can grab a hold of that kind of stuff, then you can get yourself centered and be like, oh, there is stuff out there, and there are resources and humans on the other end of the phone that can help me figure out where I can get some assistance when I desperately need it.
Okay.
Yeah, and Tony, let me just weigh in on this because someone said it, I think last year on this show when we were talking about prescription drugs and we had these callers call in, and one of our experts said, you date your prescription drug program, but you marry your Medicare program. And that's a good way to look at it because when it's, and Lee, you could speak to this as well, but when we're talking about picking whether it's Medicare Advantage or traditional Medicare, that question is so important right out of the gate because it's really difficult to change once you make that decision. However, when we're talking about prescription drugs, the benefits change. And really, you can change during open enrollment, which started October 15th, you can change your prescription drug program based on your current conditions fairly easily. And one of the things I always like to recommend to people is to talk to your local SHIP counselor, your state health insurance information provider counselor. It varies from state to state, but it's SHIP or SHIIP, depending on what state you live in. But they are government-funded officials who are volunteers, essentially, who are experts on Medicare, who can walk you through. They're totally unbiased, and so they take your information, and then they walk you through some of those really good decisions, or some of those things that you have to consider as you're making these decisions. And so I am curious from the callers, though, because we always get so much of our feedback on Medicare, as you know, through our callers, right? They always let us know, okay, this is what I'm struggling with. This is a question I have about prescription drugs. And that really helps us when it comes to our advocacy out there.
Okay. How about we go to the phone lines? Let's go to Illinois, and Paul is there. Paul, what question do you have for us?
Well, my question is this. When a person is working, we're paying for Medicare and our employer's paying for Medicare. And then when you retire, you're having to pay for it the second time. Can you explain why?
I think actually what, Paul, you may be talking about is Social Security, because there are some states where you're taxed on your Social Security at the state level. Lee, you might be able to address this in Medicare, so that might be what you're referring to, but Lee?
Yeah, in Medicare, you do not necessarily have to enroll in all parts of Medicare as long as you have coverage from your employer. And you'll qualify for a special enrollment period once that coverage ends. So they do make sure that you're not paying double. You're either on your employer's coverage or you transition to your Medicare coverage. The biggest concern there is making sure that you do not go without coverage for too long, because Medicare does have late enrollment penalties if you don't enroll when you should. So that's definitely something to keep an eye on as you're transitioning from one to the other.
And we have some good news for you, Paul. You're a winner tonight, so congratulations. By the way, give us a call tonight, 877-283-7570. We'll have more winners throughout the night. Let's go to Alabama and Henry. Henry, what question do you have? Well, we've lost Henry, so Henry, call back in. We'll get Henry back in just a moment. Again, we've talked about finding the benefits in your area. One thing we didn't mention is, I think of the Southeast and how many of those were affected by disaster. Are these benefits available to them as well?
Yeah, and this is where they should go on arp.org/ARP Live to figure out, again, go through some of those benefits. Because if you're really struggling to pay for something in the wake of these natural disasters, there are so many people who are leaving money on the table. And I cannot emphasize that enough. And so I always go back to the SNAP food benefits, because 63% of people who are eligible are not getting SNAP benefits. And this is, again, funded through the Farm Bill. You can use them at your grocery store or your local farmer's market. And so if there are people in the disasters that may be struggling with heating costs, probably not in the Southeast yet, but someday, food, Medicare, or prescription drugs, again, there are programs out there that you may qualify for that you should consider signing up for, or at least checking if you're eligible. I mean, that's at the end of the day, just log in and check if it's really easy to do that.
Okay. Now let's go back to Henry in Alabama. Henry, what question?
What are the qualifications for the SNAP program?
Qualifications for the SNAP program.
Oh, the income qualifications. So it does vary. And so what I would recommend to Henry and anyone who's considering applying for the SNAP program is to go online. Just Google SNAP USDA or Google SNAP food benefits, and it'll have a very simple calculator that you can log into that will tell you whether or not you are eligible for those benefits. And because it does vary, and I don't know Henry's status yet, but it never hurts to check.
All right. Don't forget 877-283-7570. So from Alabama to Michigan and Teresa. And first off, Teresa, before your question, congratulations, you're a winner as well. Now that we've got that, what question do you have?
My question is, my husband is turning 65 soon, and he signed up for Medicare, but he hasn't signed up for the supplements yet. Is there a grace period, or does he need to be signed up by his birthday?
So you have a 6-month period around when you turn 65 when you can qualify for those Medicare supplemental plans. And it is incredibly important that you do sign up when you first become eligible to enroll, because after that, plans can either choose not to provide you coverage or charge you much higher premiums based on your health status. So if you are choosing to go with traditional Medicare and want to get one of those Medigap or Medicare supplemental plans, definitely keep that date in mind. Again, it's a 6-month period when you can enroll.
All right, 877-283-7570. We'll go back to the phones. How about Iowa and Bev? Bev, what's your question?
I am paying for Plan D. I have to pay a penalty because I was off of that for about 5 years. Is there any way that I can get out of that, paying that for the rest of my life?
So you are talking about that late enrollment penalty that I mentioned previously, and that is something that unfortunately you do have to pay after you go for 63 days without what is known as creditable coverage, or coverage that is equivalent to what you would get for a Medicare Part D plan. You can try to get an exception. I can't say that it's easy or that it happens often. Unfortunately, the reality is that is something that you probably will have to continue paying.
Yeah, and I just want to mention, and I've heard this, but when it comes to your Part D question, because that was a good question about the penalty. When it comes to your Part D plan, would you recommend people check annually to see if there's a better, more affordable plan out there? And if so, how do they go about doing that?
Question.
I love that question. Thank you so much for asking that question. The answer is absolutely yes. You should be looking at your Part D plans every single year because they can change considerably from year to year. And what we find is that a majority of people do not look at their plans from year to year, and they just tend to stick with the one that they've been in. And that can actually leave a lot of money on the table because you can have a higher premium, or you can have a different deductible, or there can be changes in which prescription drugs are covered or how much you have to pay for them. There's a lot of changes that can happen from year to year. So, and especially this year, given all the changes that are going to be taking place next year under the Medicare Part D benefit, like that $2,000 cap that I mentioned, this of all years is the most important year for everyone to take a look at their plan options and make sure they're in the best one for them.
Just quickly on that too, and back over to Lee. One of the things you said can happen, I want to make sure that people understand, like they could be in a plan, a Medicare Part D plan right now that covers some specific drug, but next year that drug may not be on that plan. Is that correct?
That is absolutely correct. Okay. And another thing you can find is that there may be utilization management, so things like prior authorization added to your drug. So that's something else to keep an eye on. But I will say the thing that most people keep an eye on is definitely that cost sharing. You can see a shift from a flat co-payment where you're just paying a certain dollar amount to something called co-insurance, where you're paying a percentage of the drug's price. And that can really increase your costs month to month. So it's really important to keep an eye on what drugs are covered and how they are covered, because it can change a lot from year to year.
Okay, phone number again is 877-283-7570. Let's go to the Lone Star State, and Gail is there. Gail, what's your question?
Yes, I was wondering, is there any certain plan that pays for weight loss medication like Ozempic, Wegovy, if a person really needs it from the doctor?
That is another great question, and is a topic, a very hot topic at the moment. So there actually is a prohibition on Medicare Part D plans for covering weight loss drugs. That said, there are Part D plans that do cover those drugs under certain circumstances. And that kind of goes back to what I was just saying about shopping around. If there is a specific drug that you are taking or would like to take and you have concerns about coverage, you should go to the Medicare Plan Finder, which is this incredibly impressive website that is medicare.gov. And it will allow you to enter the drugs that you are taking and use that information to compare plans at all levels. So whether you want to look at the premiums or your total costs or whether those drugs are covered, that website will give you that information. So if you are interested in a specific drug and making sure you are in a plan that covers that drug, that is where I would start.
All right, phone number again, 877-283-7570. How about we go to Arizona? John's on the line. John, what's your question?
Well, my question is, I'm taking 2 pills. One is Jardian, and the other one is Eliquis. And they're costing me, I have insurance, but they still cost me like $240 for a 90-day supply of both of them. Now they're telling me, I went into the donut hole. So when I went to pick my 2 prescriptions up, they were for 90-day supply for Jardian and Eliquis. They cost me $900. And I'm trying to...
I have some incredibly good news for you. First of all, the coverage gap will be eliminated next year. That is part of those changes I was talking about to the Medicare Part D program due to that 2022 law. So you will no longer face a change in your cost sharing depending on where you are in the Part D benefit.
So the donut hole's going away.
Donut hole is gone.
Good.
As of next year, we will not have to talk about donut hole ever again.
The commonly referred scourge of the donut hole.
Exactly. We all know it is gone.
Right.
Yes. So we're all very thankful for that. The other thing that should be helpful to you is, to the extent that you are on expensive drugs, that new $2,000 out-of-pocket cap will provide you with some level of relief because you will no longer have to face those high out-of-pocket costs. And the other thing that I have to mention, which we haven't mentioned yet today, is yet another provision within that 2022 law is allowing Medicare to negotiate the prices of prescription drugs. And the 2 drugs that you mentioned are among the first 10 drugs that were negotiated. And those prices will become available in 2026. So you will see savings there as well. So you will see some pretty substantial benefits in the next year or 2. And again, all good news coming from that law.
And quickly, he's probably a pretty classic profile of a Medicare beneficiary that's going to really see those benefits, particularly with secretarial negotiation coming up, right?
Absolutely. And the prices that were negotiated are going to result in savings of $1.5 billion in out-of-pocket costs in that first year that those prices are available. So we really are talking about significant savings for the people who are taking those drugs. And I should also mention this is just a start. We are getting ready to select the next round of drugs that are going to be negotiated, and there will be additional drugs negotiated every single year. So even if your drug was not selected for this first round, there is a very good chance that it will be selected in a coming round, and you will see those savings then as well.
And I just have to add quickly, AARP fought very hard for these savings in prescription drugs. We fought for more than 10 years. We had volunteers across the entire country talking to their members of Congress, talking to their senators. We would ask in town hall meetings. This was a key advocacy item for AARP. Lee was front and center in our debate, and so she's responsible for a lot of these savings, I like to say. But and so I'm just really proud of the work that our volunteers did across the country to get this legislation passed.
Yeah, and it's really important to Lee and Brad's point that people know this is coming. Again, a lot of this stuff, people, these benefits seem hidden. They don't know where to, but this really is coming. And in the same way the veterans have had these prescription drugs negotiated for them at a very low price. We've been, Brad said the last 10 years, I think AARP has been calling for this for most of its history. For many years, there was no prescription drug benefit in Medicare at all, and it was all the drugs were paid for out of pocket. This is really, really, really good news, and AARP fought really hard for this, and we're really proud of the work we did.
All right, let's go back to the phone lines. Can we go to Kansas? And I believe we have, is it B?
Yes.
D. Okay, hi D. What's your question?
I didn't know that they were going to put me in the hospital, and I didn't bring my medicine with me. And now my hospital charged over $700 for 2 shots of insulin. And I had to pay that $700 before my insurance, so I can appeal it. My insurance refused to pay it.
I am incredibly sorry to hear that happened, and I know that can be very complicated because you are kind of operating in between parts of the Medicare program, for lack of a better way of putting it. Because you were in the hospital, that's technically Medicare Part A. But because you're taking insulin, that's under Part B or Part D. And unfortunately, there are situations where these prescription drugs can be viewed one way or another, and the cost sharing can change considerably. This is definitely something that you want to take up with your plan to make sure that they cover it, because this should be something that is covered for you.
And let me just add again, the state health insurance assistance programs that Brad just talked about, the SHIP programs, I would strongly recommend that you Google SHIP and the town that you live in or the county that you live in. There'll be an 800 number. These are highly trained folks. Call them right away. Call them tomorrow and tell them what's going on, because they may be able to provide some real assistance to help you navigate the insurance company issues. And insurance companies are notoriously difficult to deal with, and these SHIP volunteers are trained to help you do that. So go ahead and make that call. It really may end up being extremely helpful.
Okay. By the way, D, you're a winner. So maybe a little bit of good news for you tonight. Okay, Brad. We've got an online event coming up. What can you tell us about that?
We do. We have a free online Social Security Understanding Your Benefits event. That is Tuesday, October 27th, and this is at the AARP Virtual Community Center. It's 7 p.m. Eastern, 4 p.m. Pacific, and basically, this is an event where you can ask any question under the sun that you have about Social Security and your benefits, and you'll have an expert on the line specifically from Social Security Administration to help answer those questions. So I strongly recommend, if you do have questions about Social Security, to logging in. All you got to do is to go to aarp.org/AARP Live to register. So register for that event. It's a great one, and you'll get a lot of questions answered. I also want to put in a plug for our state offices, because we have offices across all 50 states and territories, and 53 states and territories. And we've got a lot of in-person and virtual events. So if there are members out there or even non-members who haven't really checked out what's local, go to aarp.org/local, and you'll see whether there's a Social Security event, potentially it ranges from yoga classes to caregiving events to brain health events to everything under the sun. And most, if not all, these events will be free.
So now I'm just curious, is goat yoga in there as well?
Goat yoga feels like a Northwestern thing.
does feel like
I bet they've
Oregon
got
or
that in
Washington,
Oregon.
they have
Yeah.
that.
Okay, we're going to take a short break, and when we come back, we still have a cooler to give away. So give us a call. The number is 877-283-7570, and join the conversation. Welcome back. We still have a cooler to give away, but as promised, want to announce our second chance winner from September. And our second chance winner from Georgia, Randall C. Randall C. from Tucker, Georgia, our winner. And since you provided your information when you scanned the QR code, your cooler is on its way. Now let's go to the phones and give away another cooler. Okay, this one is, let's see, Ronald in Iowa. Ronald from Iowa. Ronald, you have a question for us?
Yes. I dropped my supplement plan because it got too expensive, like putting $700 a month. So then I signed up for Medicare Aarp Advantage plan, and I need some dental work, and I was wondering if anybody would take care of that.
That is another great question. Medicare Advantage plans do often provide that kind of coverage that is not typically available under traditional Medicare. So that kind of goes back to comparing your options. I'll go back to beating that drum. During open enrollment, which as you heard runs from October 15th till December 7th, if you go into the plan finder that I mentioned on Medicare.gov, you can take a look at the Medicare Advantage plans that are available to you in your area, and you can specifically look to see which of those plans offer those types of additional coverage. There is a very good chance that you'll be able to find a Medicare Advantage plan that does offer some level of dental coverage.
Okay, let's go back to the phone lines. Again, we're at 877-283-7570. 877-283-7570. Let's go to Illinois and Earl. Earl, you have a question for us?
Yes, basically, I'm a veteran, and I pay veteran benefits, but I still pay co-payments. Could I basically drop my Plan B?
No, no. I mean, you're still in traditional Medicare, Earl, so you don't want to do anything. You still want to stay there. I'm wondering if you're talking about, because you get your prescription drug benefits through the VA program. Is that correct?
I think we've
lost
Earl already.
Yeah, I'm not quite clear on which aspects of coverage he was talking about. I do know that the veterans coverage for prescription drugs is pretty generous and much less expensive than Medicare Part D. So if he does have access to that, that's definitely something he should consider keeping and not getting a Medicare Part D plan.
Yeah, if that is the quote, right, there's absolutely, right. I mean, the VA program is much deeper discounts, even with all the advances we've now made with Medicare and prescription drugs.
Correct.
And Tony, this is a show about benefits, and so I do want to bring up, VA has all kinds of great benefits that people may not be aware of. One of the benefits that we're really trying to highlight at AARP are home modification benefits, and so these are funds that are geared towards helping people stay in their home. So if you need a ramp, for example, or if you need to carpet your steps that go upstairs, or if you need new doorknobs, depending on what home modifications you need. And the VA offers, I think, north of $6,000 if you're eligible for a grant program to help pay for some of these benefits. And I know one real popular one, for example, is modifying your bathroom so you can have an easy walk-in shower versus having to step over a bathtub. $6,000 could cover that, right? And so there's that benefit. But in addition, if you live in rural America, which a lot of our callers do, USDA has a similar program that is a grant program that can help with home modification up to $10,000. So this is, again, a grant program, not a loan. And you could apply, if you just go to USDA home modification, you could figure out if you qualify for that. And they define rural as a population if you live in a community of 20,000 or less. So.
Let me just also add to that really quickly, Brad's discussion about the bathroom and then the walk-in showers, and Lee might want to comment here too. Slip and fall injuries are very, very preventable. Walk-in showers, carpets on the staircase. The cost to Medicare for someone who slips and falls adds billions of dollars to the program. I don't know if there's anything you want to add to that, but these are preventable. Slips and falls are preventable, so we strongly encourage you to look at that, and it become very expensive for folks on the back end.
Yeah, going back to what Brad and Greg have been saying all along, this is definitely a place where it is worth checking to see whether you are eligible for the benefits that they are describing. Something as preventable as that, and unfortunately as expensive as that can be, is definitely something worth looking into to make sure it's not something that happens to you.
All right, let's go back to the phone lines. Still have a couple of lines open if you want to get in tonight. 877-283-7570, 877-283-7570. Have a couple on hold right now, but let's take her off hold from Alabama. She's a winner. It's Sandra. Sandra, what's your question?
My question is, we have Medicare, and we have a supplement through AARP, United Healthcare. But then we pay for a prescription card that costs us $100 and something a month, and yet they put us in a gap. Right now, I'm in a gap. So I am trying to find out what I can do. Is there something else that we can get or do? And is this Part D, does that include what you're talking about as far as our insurance is concerned, or is it a different program than what we have?
I completely sympathize. The coverage gap has been the bane of our existence for, unfortunately, way too long. And as I mentioned previously, it is going away. So this could be an issue for you this year, but starting in 2025, you will no longer have to face the possibility of entering the coverage gap. As far as the costs that you're facing on a monthly basis, those premiums, they are something that can increase considerably from year to year. So to you in particular, I would highly recommend taking a look at your plan options. There is a good chance that you can find a Part D plan that covers your prescription drugs for 2025 that is less expensive, especially with that new $2,000 out-of-pocket cap. If you get lower premiums and get that cap and make sure that you're in a plan that really fits your needs, I think you should see your costs come down considerably.
And Lee, if Sandra wanted to go online, what would that website be? Because I do know you can check those plans through SHIP, as we keep talking about, right? So her Alabama SHIP program, right, she could literally call them and just walk through it with a volunteer counselor. But if she were able to go online, what would that website be to check those plans?
That is at the Medicare.gov website. You could Google Medicare Plan Finder or Medicare Plan Compare, depending on how you want to go about doing it. But both of those will get you to that website that I mentioned, where you can enter your zip code and your specific prescription drugs and use that to take a look at your plan options and get an idea of which one would be the best fit for you.
All right, phone lines, 877-283-7570, and that's where we go to Colorado and Charlotte. Charlotte, what's your question tonight?
Well, I just wanted to make a comment, more or less, because I've noticed that you all are very good at computers. You're a little bit younger than my friends are, but I have friends that are scared to death of computers, and they need to know a phone number where they can call and get the same information that you're telling us to go online and look at. I can do it, but I have many friends that can't, and I know they always comment, well, I don't have a computer. I'm scared to death of them. I don't want anything to do with them. And so there it gets dropped. But I have friends that are even younger than I am, and I'm in my 80s, so. But I was fortunate to work with them for a lot of years, and I'm not scared of them, but I have many friends that are. And I also want to make a comment about, I have Plan F in the Aarp, United Healthcare, and I took it out for both myself and my husband when we were 65, and I afraid to let it go because you can't get it back if you let it go. And so I have to check with my insurance man to see if I should go on Medicare Advantage or if I should keep my supplement. So I just wondered what you would suggest.
Okay. You want to start?
Well, a couple things. I mean, you could address the Medicare, but on the piece about not everybody knowing how to use a computer, we get this all the time, and I think it's a really important comment because not everybody is comfortable with using computers, and not everybody has access to computers. Everybody can call the 211 line, which is United Way number that gets you directly to a person who can help then navigate you and provide you another phone number to the local SHIP program or to a local navigator that can help you understand this. If you go to your local senior center for a meal each week, or you go there for an exercise class, your local senior center will also have all of these phone numbers as well. So for folks that aren't using computers, 211 is a good way to go. And again, using resources in your local community like a local senior center.
Lee, you want to jump in too?
Sure. Actually, that's a really good question, and I also get that question a lot. And one other phone number to keep in mind is 1-800-MEDICARE, which will connect you with Centers for Medicare and Medicaid Services, which is who is responsible for the Medicare program. And they should also be able to connect you with your local SHIP. So I think that is another possibility for people who aren't necessarily comfortable with using a computer. As far as your question about what to do with Medicare supplemental, that's a tougher question and one to take up potentially with your SHIP.
Okay, let's go to Kentucky now. And Bill, you've got a question for us, right?
Yes, I do.
Okay, go ahead.
Okay. How come the Medicare does not pay for caregivers who take care of their family members? My wife had a massive stroke almost 9 years ago, and I've been taking care of her ever since. And my life's been put on hold because I'm the only one who takes care of her. Now, if I put her in a nursing home, then the Medicare would pay the nursing home people to take care of her, but they don't pay me, which would be cheaper than me paying, them paying nursing home. And
well, that's a good question.
That is a truly tough and timely question. And that is another area where AARP has been working for a very long time to try to ensure that caregivers get the support they need, because we know how many older Americans are really struggling with providing the care that their family members need. There has been some recent progress, but it's definitely one of those longer fights, kind of similar to prescription drugs, where AARP is going to continue fighting for our members, recognizing this is incredibly important to them.
Just a quick add on that, too. Medicare will pay for a limited amount of time in a nursing home, 90, 120 days, something like that, right?
Under certain circumstances.
Right.
Yes. And
so just to be clear, it will not pay for long-term care services in perpetuity, which is, again, the huge problem here, which is why for the last 9 years you've had to be in the situation where you're providing as a primary caregiver and getting no relief. It's a huge issue.
All right, let's go to Indiana now. We have Kelly on the line. Kelly, what's your question?
Just generally, what would be the advantage of going with a Medicare Advantage replacement plan versus just having your basic Medicare and supplement plan?
That is a question we get a lot, and it is a tough one, but I will try to give a relatively quick answer. So Medicare Advantage differs from traditional Medicare in a few ways. One is that it's managed care. So it's an instance where you're going to need to look into whether your providers, whether your hospitals, the healthcare providers that you want to see are in network, whether the local hospitals are in network. It's definitely something that you have to keep an eye on from year to year because that's something else that can change. One thing that people do like about Medicare Advantage is that it has an out-of-pocket cap that traditional Medicare does not. But as I mentioned previously, you do have that network to contend with. So oftentimes people may find that they ultimately reach a point where they would like to have access to all providers. And under traditional Medicare, that is the case. As long as the provider accepts Medicare, you can see them. Unfortunately, if you've left traditional Medicare and you had supplemental coverage, you can't get it back. And so that's just something to keep in mind as you're looking at these options, is making sure that you're comfortable with the idea of a Medicare Advantage plan and being in managed care, or alternatively looking at traditional Medicare and having access to all the providers that you may want to see.
Okay. I think that's worth repeating, actually, because that is a huge point. So if you leave traditional Medicare and you go to Medicare Advantage, you cannot go back to traditional Medicare.
You can go back to traditional Medicare, but you can't get a supplemental plan.
You can't get a supplement, which you basically would need in traditional Medicare
right,
to cover a lot of your, right.
Exactly. Supplemental coverage provides or pays additional costs that you might be facing under the traditional Medicare program.
Okay, we're coming to the end of the show, and I think we've had a lot of information here. So how about we get some final thoughts, if you will, and let's start with you, Lee.
First of all, I really appreciate the opportunity to be here today. This has been a great conversation, and I've really appreciated the questions. If I could leave people with one thing, it is going back again to my drum of it is open enrollment. Please take a look at your Medicare plan options and make sure you are in the best plan for your needs. There are some great plans out there. We want to make sure you're in the right one for them.
Okay. Brad, how about final thoughts?
Well, my final thought is Lee is amazing.
We agree.
Right? I mean, can we just agree on that one?
Absolutely, we agree.
I've got a website I'm supposed to plug or anything, but I just want to say Lee is amazing. So great job tonight. You're just such a fabulous spokesperson for AARP. But I do want to say Americans, again, are leaving too much money on the table. You could be eligible for benefits you are not receiving. Go to aarp.org/AARP Live, the name of the show, and you're going to find websites that will guide you to some of these other potential benefits that we talked about: the Medicare Savings Program, SNAP benefits, extra help. I mean, you could save thousands and thousands of dollars. So really encourage you to at least, again, check to see if you're eligible.
Okay. Final thoughts, Gray?
I have an unusual final thought tonight, and I just want to wish my good friend and my colleague over here, who's going to be joining the ranks of AARP eligibility here in about 2-3 weeks. I think we already put him on the cover of our magazine, which goes out to millions of households. No, you actually won't see his face on the magazine coming up. But about a couple, 3 weeks earlier, a big happy birthday to Brad, who's going to be 50 years old, and is also a wonderful spokesperson for the things that AARP do around the country. Happy birthday, friend.
Oh, thank you, brother. Yeah, that is, what a great surprise. That's awesome. Yeah, I'm joining the ranks. I'm excited. I'm going to be, you can join AARP at any age. That's right. I get that, but I am going to be kind of AARP official come November 27th. So I'm pumped about that. Thank you.
There you go. That does it for tonight. Join us next month, November 17th, when former fraud investigator Doug Shadell joins us to reveal the latest holiday scams and how to spot them. You know, as we move into the holiday season, it seems like scams are all around us. So this will give us a great opportunity to spot those scams and then address them.
This is a really important program, so we encourage you to tune in. Doug is a national expert on all this and will really provide some great help, in much the way Lee has tonight.
There you go. We'll see you back next month. Thanks for joining us. Good night.